Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. We are at episode 130, and I know everybody's been listening to podcasts regarding the pandemic and COVID-19, and you're probably tired of it. I know for a fact I'm kind of over it myself, but it's in the forefront. But today I wanted to put maybe a positive spin on it and just give physician business owners maybe some ways that they can improve cash flow during the pandemic, and hopefully this will just really just kind of help you get a mindset there. So something to talk about with your physicians. So number one would be if you or other providers in your office are working less hours, then go to a part-time malpractice policy. Most carriers are allowing this temporary change and will go back to date less hours when the less hours started. And so that can actually save you, I would say, thousands of dollars during this time. And so something to really consider. And then number two, reach out to your credit card companies. Ask for zero interest, zero penalties, zero minimum payments, at least for 30 days. Most of the payers are doing that. And most credit card companies are allowing this. Have it in writing if possible, but I don't know how many of you check your bank account or check your credit card or whatever to pay it, and you see all those flashes of, do you need help during COVID-19? Do you need this help? And all you have to do is call. So they're being given money from the government to offset things the money that they're not getting. So take advantage of it as far as if you need it. So if that's something you need to do, talk to your physician. But for those of you personally that need to do that, make sure you call. It just will help you because you don't know what the future holds. Now, you've probably already done this, but be sure that staffing matches your current volume and that your practice is not overstaffed. You want to have a business to reopen at full force, and giving away too much money in the form of overstaffed is bad for the overall team. And remember, if you have to do layoffs, you still can pay them with that new PPP, which is that payment program that's out there for during this time. And so you are getting money to help supplement your staff that you've had to maybe cut back hours or lay off for a little bit of time. So there's money there so that you can basically offset some of those losses. Number four, go through the household budget and make appropriate changes to how much you normally spend on eating out, childcare, vacations, and other areas where you're currently saving money due to coronavirus. I bet that is several thousands of dollars saved right there. Another thing right now, and I'm not saying you should take advantage of the situation, but I'm saying that there's waves of things within the economy. And if you've had any look at what it costs to go out of town right now, if you want to schedule that late vacation in the fall or late vacation in August, look at hotel rooms right now. They're almost half to what they used to be as far as cost. And so you could schedule a vacation pretty far out, and there's actually some safeguards, even if it doesn't work out, that you can get that canceled or your money back. So just some things. I mean, when things go in waves, you have to make sure that you can, again, I don't want to call it capitalize, or take advantage, but that you can, like everyone else, try to at least get that budget-friendly cost when you can. Also, mortgage companies, they're allowing customers to push up to 3 months worth of payments to the end of their mortgage. And that's pretty sweet. If you get to do that, I know that that's something that a lot of people that would really help them, because 1 month is helpful, which a lot of renters are doing. They're getting that 1 month. I know the lease on my office building, they cut everybody 20% so that you can have a little relief there. But if you can get relief on your mortgage, you can basically put that towards the end. And that just gives you breathing room instead of 1 month. But 3 months is pretty good. And especially if you're a physician, that's also if you own your building or something to that effect. Number 6, apply for federal programs like the Payroll Protection Program I mentioned, SBA loans with forgiveness clauses, and possible HHS, Medicare, Medicaid payments if you accept those plans. But what you want to look for is you want to look for the plans that actually offer forgiveness, that are grants, that are things that you don't have to pay back. I see a lot of practices that are enrolling in the advance payment for Medicare. They said they paid over $34 billion in that. And to me, that's just a short-term loan. They're going to start offsetting your Medicare checks in 120 days to recoup that money. Seema Verma, who is the administrator of the Centers for Medicare and Medicaid Services, so CMS, she was saying that those are loans and they're going to ask for that money back. So you want to just be really careful with that, because you could end up, oh my gosh, the accounting nightmare that could happen there. So really look for those protection programs that offer relief where the forgiveness is at the end if you meet certain guidelines. So they're giving grants to people that have certain losses, making sure that that if there's a possibility that they're not going to be able to recoup those losses, and you can just keep that money. And so that's who it should go to, not to big corporations who they're trying to bail out. It should go to the physician practices, to the small businesses, and there is some relief out there. Number 7, speak to your vendors for vaccines and other medicines and equipment to see if they can provide extra time to make a payment, or extra time before they charge your credit card if it's an automatic charge in their system. Many of them are helping their customers this way. So just speak to vendors. You never know. Number 8, make sure that you're vigilant with getting paid as much as possible from your accounts receivable. So for those of you that are coders and billers and, collection staff, let's say you're a coder and your volume has gone down 50% as far as what you do in your practice because your patients aren't coming in and a lot aren't even comfortable with telemedicine. Well, you might want to volunteer your time, not saying volunteer non-paid, but say, hey, I'm available under my employee contract to help with collections. Give me an AR and I can spend time during my day calling insurance companies, getting that money in. And this is a time when if you've got staff that, you're cutting back hours and everything, utilize some of those staff members who have the time to work your AR. This is really important to get all of the money you can right now. Even balances that are over 90 days on the aging report, it's not often you have the time to work those, but make sure both patients and insurances are pursued for any and all balances owed. Work out something like a payment plan with the patient that's struggling. But I think a lot of things right now, everybody's thinking it should be free, and it's not. You have to go back and really work those accounts. Number 9, take care of household projects, landscaping, cleaning, things that you may have normally paid someone else to do, but now you have the time to do it. So that could save you as a physician and also give you some mind space. If you're not on the front lines of COVID, or if you've got some time, if you were on the front lines and now you're back in your practice, if you're a surgeon that you had to cancel all of your elective surgeries, if you're a family practice where you can only see patients part-time and a little bit on telemedicine, you've got some time there. Take on some projects. I know I did in my household. I started putting up curtains where there were blinds, and I actually planted an herb garden, and now we're going to plant jalapenos in a pot because I live actually on a golf course. So they don't like you planting on the actual greens of a golf course, but you can plant those and tomatoes in a big, flower pot just on we have really huge decks. So just something, if you're looking for those projects, if, we've called this spring cleaning and they just wait and wait and wait. And pretty soon, you've got a couple of years and you're still waiting to do that project. I know I just retiled a bathroom. And so things like that. Now I'm really busy with all of the telemedicine and everything going on. So I'm actually working longer days, but I have a daughter who is a teacher, and she's doing distant learning with her 8th grade English students. Plus she's in her master's program, and I'm noticing she's got some time on her hands. So who's taking care of some of my projects? You'd get it, Summer. So I know some of you have heard me talk about her before. So for those of you that are physicians and staff, also, give your kids some projects. They're at home, watching probably too much TV, playing too many video games. This is a good time to really enlist their help too. And it gives them a sense of pride if they're helping to keep the household going and things like that, or at least it should. But that's also a way to kind of get through this pandemic. And number 10, make sure that you are thoughtful and generous to others during this time, because that will come right back to you tenfold. I know we try to support our local businesses and restaurants at least once a week. I always give them for breakfast. The other day, I stopped by one of our local diners, and I think my bill was a total of $10.17. Floated them a $20 just because I want them to know that I understand and feel their pain there. And so things like that can really be helpful. Obviously, you want to stay home as much as you can while we're still under the quarantine. But we're, a month into this now, and I know everybody's kind of getting bored and trying to figure out what to do. And this can just be maybe some mental health options that can help you out during this time. But also for the physicians, it just gives them a sense of how do I get through this from a money perspective. But for those of you that aren't physicians and are coders, billers, and et cetera, think of some of those things to utilize as far as calling your credit card companies, getting some relief there. Because if you even have disposable income right now and you are getting paid still, you don't know what's going to happen a month or 2 months from now. And since it's available and it's not going to cost you anything, it's not going to hurt your credit, it's something that you can just push forward if you so inclined to do so. It's available to everybody. So just something to really consider as you're moving forward with all of this. So I wanted to keep today's episode kind of short. I just wanted to hopefully throw some positivity your way. And I really hope everybody's making the best of all this. I'm hoping they open up the country soon and that we have flattened the curve. I just saw a report today that New York has now been pretty stable as far as ICU entries, as far as ER visits. They said that they're now on a decline. I'm in California, and I've noticed that regardless what the news is telling you, I've heard from my own clients, and I've got hundreds of them in California, and they basically told me that it has slowed, it's gone down, and more people are recovering who have either contracted the virus, been tested positive for it, etc. So I was tested as well. It looks like I had it in January. I thought I did, and I'm fine. So a lot of times it's just really just getting through it, and especially if you're a healthy person. So our hearts go out to a lot of the people out there that are Medicare age, are struggling with some respiratory, asthmatic, or certain issues. And they're struggling with it. So we really, our thoughts and prayers are with those families. But if you're healthy and if you're low risk and things like that, make sure that you're exercising, you're getting enough rest, and you're picking up some of these things within your household so that you can, start anew. When this is over, you're going to be really happy that you look around and realize that you got some things done in your house. And if you're really bored, start a podcast. I have 5 of them. You know that I'm always talking about it. So really check out my business collective that dropped a couple of weeks ago, and we're going to be episode 4 on Monday. And then it's on Mondays, and then also football season we hope is going to happen. So you'll hear me on my What the Football, WTF, when the season starts on Steel City Underground. And then the Bun Life podcast is coming back, and that's just me and my daughter having a good time. So everyone, stay positive, make it a great day, make it a great week, and thank you this week for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.